Hey medicos, is perfection Alice is here. Let's talk about farmer's lung. This is a video in our series about occupational lung disease. So let's get started. This farmer's lung disease is due to exposure to either moldy spores or hay. Okay, like a needle in a haystack. This is hay. Okay. This farmer here is saying, "Yeah, what a great moldy hay! What a great moldy hay!" He is carrying a fork with three spikes because, as we all know, this disease is type 3 hypersensitivity reaction. So let's get started. Hypersensitivity reaction. Farmer's lung is a hypersensitive pneumonitis. What is hypersensitivity pneumonitis or HP? It's an extrinsic allergic alveolitis, so it's an allergic reaction. The antigen is known. I know which antigen. It's not type 1 hypersensitivity. It's not IgE antibody related. There is no eosinophilia. However, there is IgD antibodies. There are T lymphocytes. This is well follow a restrictive lung disease pattern more than obstructive one. So, what you think about the FEV1, FPC? What do you think? This ratio will be normal, low or high and restrictive lung disease. It's either normal or high. However, an obstructive it's low. Gay. What a great moldy. Hey, since we have talked about hypersensitivity pneumonitis, let's get more specific. Farmer lungs, it's a type 3 hypersensitivity reaction. The bacterium involved here is Secera polyspora recta virgulae, also known as thermophilic, acting on my series. This is the farmer name or the historic name. On first exposure, IgG antibodies will precipitate, and they originally in the serum. Okay, IgG antibodies, that's fine. On the second exposure, this antibody will bind to the antigen either from the mole or from hay and forms antigen antibody complex. This complex will precipitate here and the wall of the alveolus, and of course when you have a gas exchange is going this impedes gas exchange on chronic exposure. Granulomas can form and of course that granules are for hypersensitivity reaction. So farmer's lung is type 3 hypersensitive reaction. Sakura polyspore attractive virulent. First exposure antibody, second exposure antigen antibody complex. They participated in the alveolus. How to treat this gentleman? First, avoid exposure, but it's very hard to tell a farmer to quit his job. That's how he makes a living. So, at least to wear a mask. The treatment here is steroids. Okay, that's the definite treatment for this condition. So, that said about farmer's life. How do you like this guy? Isn't he awesome? Hey, what a great moldy. Hey, seeing the next video. Hey medicos, is perfection Alice is here. Let's talk about farmer's lung. This is a video in our series about occupational lung disease. So let's